This is the ABCs of Newborn Care. I'm Dr. Cheryl Gatewood Tolliver, medical doctor and board certified pediatrician. Z is for zebra. In medicine, we are taught to expect horses, but the circus could always be in town. Translated, common things are common, but we have to look for uncommon diagnoses that could present serious problems for your baby. For this reason, prenatal care is vital. So here are a few of the zebras that, if recognized during pregnancy, may provide an opportunity for early intervention and improved health of your child. Group B strep is a bacteria commonly found in the vaginal area of healthy women. It may or may not cause infection and generally goes unnoticed unless it appears on testing. This same bacteria may cause significant illness in the newborn, including pneumonia, sepsis, meningitis, and even death. Pregnant women are routinely screened for and treated for Group B strep in the last trimester to protect the baby. Torch infections include toxoplasmosis, O is for other, that's syphilis, varicella zoster, parvovirus B19, R is for rubella, C cytomegalovirus, and H for herpes. Most torch infections may make the mother only mildly ill but have serious fetal consequences. Toxoplasmosis is a parasitic infection found in undercooked meat and cat feces. For this reason, mothers are told to avoid foods like sushi and cleaning the kitty litter. Infection in the baby can include eye infection, swollen glands, liver or spleen enlargement, and jaundice. Congenital syphilis occurs when the mother has syphilis and passes the infection on to her baby during pregnancy. Congenital syphilis can cause miscarriage, stillbirth, prematurity, low birth weight, and death shortly after birth. Babies born with CS can have deformed bones, severe anemia, enlarged liver and spleen, jaundice, brain involvement such as blindness and deafness, meningitis, and skin rashes. Congenital syphilis cases have more than tripled in recent years. Over 10 times more babies were born with syphilis in 2022 compared to 2012. Varicella zoster is the virus that causes chickenpox. Congenital varicella may be transmitted early in the pregnancy. Affected individual babies may have characteristic abnormalities of the skin, extremities, and eyes. Parvovirus B19 is the virus that is responsible for several syndromes, including slap cheek disease, a benign childhood illness. However, primary maternal infection is associated with up to 5% fetal death. Rubella causes German measles, and mother may have symptoms such as low-grade fever and rash. Pregnant women with rubella are at risk for miscarriage, and the infant may have death, cataracts, intellectual disabilities, and more. Cytomegalovirus, CMV, is a herpes virus. It is very common. It affects people of all ages and in all parts of the U.S. CMV, again, only causes mild symptoms or no symptoms at all, but it can cause serious problems in the unborn baby and newborn. Most babies with congenital CMV don't have any symptoms, but at present, symptoms may include hearing loss, small size, enlarged liver and spleen, and eye problems. Herpes simplex virus is a sexually transmitted disease which may live in the mother and may be transmitted to the infant. If the mother has an active lesion present on the genital skin during delivery, there is a 2 to 5% risk of infection to the baby. The risk of transmission to the infant may be decreased by treating the mother with valacyclovir. Herpes simplex infections can be divided into 3 categories: localized skin infection, encephalitis, which is inflammation of the brain, and disseminated herpes infection. Herpes is spread throughout the body and can affect multiple organs, including liver, brain, and kidney. Congenital heart disease is an abnormality of the heart that develops before birth. Generally, there are three types of heart defects present at the time of birth: a hole in the heart, leaky valves, and defective vessels. Symptoms may include abnormal heart rhythms, blue tinted skin, shortness of breath, difficulty feeding, and swollen body tissues or organs. Some heart defects do not require any intervention. Others may require complicated surgery. Close follow up with your pediatrician or pediatric cardiologist is imperative. If you have found this video to be helpful, please like, share, and follow.